Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is Cleaning and Disinfecting in Environmental Services. This webinar is part of a new collaboration with West Virginia Project Firstline. Starting this month, speakers from West Virginia Project Firstline will be joining us on the first Wednesday of the month to provide education on infection control. Everyone has entered the meeting on mute, but we will have a discussion following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is Building Bridges, Fostering Engagement Between Medical Directors and Facility Staff to Create Optimal Outcomes. And that webinar will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guests today, Elizabeth Dauch and Cindy Holmes of West Virginia Project Firstline. I will introduce Cindy first because she will be doing most of the speaking, and Liz will probably be doing the Q&A for us today. Cindy is a registered nurse with over 40 years of experience. Her work experience includes direct patient care in various settings in acute care hospitals and director of surgical services. Cindy has also worked as consultant, preparing hospitals for regulatory regulatory surveys. Her last position in the acute care setting was as Director of Quality Management, Infection Prevention in Long-Term Acute Care Hospital. Cindy is currently employed as National Health Safety Network epidemiologist for the West Virginia Department of Health Bureau of Public Health's Office of Epidemiology and Prevention Services. She is responsible for the analysis of infection control assessment data, as well as data from the National Healthcare Safety Network for West Virginia from a variety of healthcare facilities, including hospitals and long-term care facilities. Elizabeth Dauch is the Director of Infection Prevention for the West Virginia Department of Health's Office of Epidemiology and Prevention Services Healthcare Associated Infection and Antimicrobial Resistance Program. She has 22 years of valuable nursing experience, of which 13 years was in the acute care setting as a clinical nurse, then 9 years as an infection preventionist in the post-acute long-term care setting at the center, regional and corporate levels. She also has infection prevention experience in a large hospital system. She is certified in infection control and long-term care certified in infection prevention by the Certification Board of Infection Control and Epidemiology and serves as a member of their test committee. Elizabeth is also a member of the Association for Professionals in Infection Control and Epidemiology and is a board member for the 2023 West Virginia chapter. Elizabeth has been awarded the 2014 CAMC Nurse Excellence and more recently the 2022 McKnight's Women of Distinction Veteran VIP Award. Cindy and Liz, thank you for joining us today.
Thank you, Kathy. Okay, so we'll get started. Today we're going to focus on an essential part of infection control, cleaning and disinfection. What are they? What is the difference between them? And why do they matter? Next slide. Oops. There we go. So, again, we're going to talk about cleaning and disinfecting. What is the difference? Why do they matter? Contact time, and then some reflection at the end. So we're going, oh, I'm sorry. So objectives, we are going to describe the difference between cleaning and disinfection and discuss why it is important to follow the instructions on a disinfectant product. So here's a polling question. You have 4 choices, and this is the definition of cleaning or disinfection. So the first one is cleaning is killing germs. Disinfecting is removing dirt and some germs. Disinfection is a type of cleaning. Cleaning is a type of disinfecting, or disinfecting is killing germs, and cleaning is removing dirt and some germs. So put in your answer.
All right, I'm going to end the poll in 3, 2, 1, and share the results.
Excellent, excellent. Number 4, that is correct. Cleaning removes dust, dirt, and germs and grime, including organic material such as blood and some germs, and the disinfection kills the germs. And we're going to learn more about them and why they're so important in healthcare. So again, what is the difference? I'm going to watch a short video from CDC by Abby Carlson.
Cindy, do you have the link there? Could you copy and paste it into the chat?
You know what? We can just, nice, stop it. We can just skip it. How's that?
Okay, sorry about that.
That's all right. I had a feeling that that was not going to work. So anyhow, this is a short video that from Dr. Carlson at CDC. She does a lot of them, and it just goes into some more definition of an explanation of cleaning and disinfection. So again, cleaning is the removal of dirt, grime, and other spills. Disinfection is a process that kills the germs. So why are cleaning and disinfecting matter? Well, in healthcare, we have patients who are ill or weak. And why does that matter? Germs are most likely to cause problems in these patients because their immune defenses may not be the same as someone who is healthy or living at home. It's important to keep healthcare environment clean to stop germs from spreading. Where and when? In patient rooms, high-touch surfaces such as bed rails, keyboards, light switches, other surfaces that may have a lot of germs such as toilet seats. So then we talk about contact time. So what is contact time? Excuse me. Contact time is sometimes called dwell time. And it's the time that the disinfectant needs to sit on a surface without being wiped away or disturbed to effectively clean germs. It's important because the product you're using may not kill germs right away. It may take some time before all the germs are killed and something is truly disinfected. This time can vary depending on the product, but is always specific and it should be on the label. Even if you're using a product that both cleans and disinfects all in one, it will still have a contact time that you need to use for it to work correctly. So the disinfectant label. What information do you need from a disinfectant label? While you can usually judge if something is clean or not by just looking at it, that doesn't work with disinfection because germs are too small for us to see. We can't judge how well something has been disinfected by looking at it. And that's why following the instructions when you're using disinfecting products is so important. So first thing you want to know is it EPA approved, which is Environmental Protection Agency, which they register all products. On which surfaces can it be used? And what germs has the disinfectant been proven to kill? And then should the product be diluted? And if so, how, so that it is safe? And what is the contact time? So do's and don'ts. Do follow the listed contact time. This ensures that items are disinfected to keep germs from spreading. Don't rush the process. In other words, don't wipe the surface to make it dry faster. Don't blow on the surface or use a fan because that will affect your contact time. So here's a sample of a EPA sheet. EPA's List N is a searchable database that makes it easy to find products that kill the SARS-CoV-2. Also, there are many other lists. When you go to EPA, there'll be a list for C. diff, etc. But List N is your list for SARS-CoV-2. So, what have we learned so far today? We've learned that cleaning removes visible dirt, dust, spills, smears, and grime, including organic material like blood, as well as some germs from surfaces. It's important to clean before disinfecting, and grime can make disinfectants not work as well. Disinfecting kills germs on surfaces or objects. It's important to keep the healthcare environment clean to prevent the spread of germs, and follow the instructions on the disinfectant label, especially instructions for contact time. So, this is also some additional resources. There's Project Firstline resources. There's resources from CDC. There's the EPA list, and some other resources that you can use to educate your staff, and especially your EVS staff. It's important to make sure that your EVS staff understand what they're doing, why they're doing it, and how they're doing it correctly. So, any questions about that before I move on?
Someone asked if we'll be emailing out that document that you shared. Was that embedded in these slides? If not, I can include that in my email when I send it out.
Which document?
I think the one in the screenshot that said which disinfectants kill COVID-19.
Yes, it's just in the slides, but the resource is here on this page. It would be the EPA's list.
Got it. Thank you.
Okay. Anything else?
That's all the questions that we have so far.
So now
I went ahead and added the link to Abby Carlson's video for the cleaning and disinfection in the chat.
Oh, thank you.
Thank you. Would you like us to show that video now? Want me to pull it up on my screen?
Sure, if you want. Or well, let me do this and then we'll go back to it. How's that?
That sounds good.
So this is another resource that I think is very helpful. It comes straight from the CDC, talking about healthcare associated infections and how to reduce your risk from surfaces. I'm not going to go into depth, but it is a good resource. It does talk about cleaning and disinfection of environmental surfaces is fundamental to reduce the potential contribution to healthcare associated infections. Inadvertent exposures to environmental opportunistic pathogens may result in infections with significant morbidity and mortality. Then it just shows you this little diagram of how a colonizer infection patient, contaminated surface can spread to healthcare personnel hands, a patient, and then a patient becomes colonizer infected. Where we can stop this is in the cleaning and disinfecting phase. The other nice thing about this resource is it gives you the core components of environmental cleaning and disinfecting in hospitals and in long-term care. And so this is a good place to go to get some information if you are trying to build up your environmental services, policies, procedures, whatever. It just tells you like the core components here that you should have in your environmental cleaning and disinfection program. You need to integrate your environmental services into, your hospital safety culture. Why is it important? It's important because it affects patients. You want to educate and train all your healthcare personnel that are responsible for cleaning and disinfecting patient care areas. This would include things like have them do competencies, return demonstrations, those kind of things. You want to select the appropriate cleaning and disinfection technologies and products based on what it is you need, whether it's, like you said, for the COVID, C. diff, MRSA, whatever. Then you need to standardize your setting specific cleaning and disinfection protocols. This may include things like, okay, what are the high touch areas we're going to clean? How often are we going to clean them? What is our protocol for terminal clean in between patients? What is our policies and procedures, like I said, for certain organisms, C. diff, COVID, etc. Then you want to monitor your effectiveness of adhering to these processes, which this means auditing. This usually is you observe who the staff that are cleaning the room. There are some checklists, I think, actually referenced on this webpage. And then you give feedback to the actual people that are cleaning and disinfecting your healthcare facility, and let them know, hey, great job, or, this isn't exactly how it needs to be done. Share with them resources, checklists, whatever, so that they understand the reasoning behind it. And then it just goes into more depth about each one of the core competencies. Again, I think this is really a good reference if you're needing to do some new policies or review your policies, revise, whatever. And then at the very end, it gives you yet some more resources. It gives you definitions. I thought this was very helpful. Definitions, some acronyms that, not everybody may be familiar with, some more guidelines and toolkits. There's how to read a label. Then again, some more resources. This AHE is the Association for Healthcare Environment. They have some good resources also. They are an arm of the American Hospital Association. And then, of course, APIC, and of course, CDC. So again, just another resource for you to use and share with your staff. And with that, I'll stop sharing if you want to show the video.
All right. Let me click that. All right, here's the video. And Cindy and Elizabeth, you'll want to turn off your video while it plays, because otherwise Zoom will stick you in the corner while it plays for some of the recorded version of this video. So you'll want to hit stop video on your settings. There we go. Okay, and now we'll hit play. And people in the chat, please let me know if you can hear the audio, because I've had problems with this in the past.
Welcome back, everyone, to Inside Infection Control, our video blog here from CDC's Project Firstline. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you here today. Today we're going to talk about cleaning and disinfection. And we hear that phrase a lot, cleaning and disinfection. They're talked about together, but there is a difference between them. What is that difference? Cleaning is the process of removing dirt, germs, and other gunk that you get on surfaces and objects. Disinfection is a different step, usually a separate step, but not always, that kills germs on surfaces or objects. Cleaning and disinfection are both very important, and they keep infections from spreading in healthcare. But how? Let's break this down a little bit. We'll start with cleaning. You can think of cleaning as removing the gunk that you can see on surfaces. It also removes some things that you don't see, like germs. When you clean your house, you're getting rid of dust, dirt, grime, and all the other spills, smears, and stuff that happen in everyday lives. But in healthcare, we do exactly the same thing. Just like your house, dust and dirt contains skin cells, dust mites, hair, debris. It's even more important in healthcare, though, because those things can get not just into the environment, but onto patients, onto wounds, onto burns, into your mouth. And we need to keep those away from our patients. And spills and smears in healthcare can include things like body fluids, blood, urine, and sweat. And we need all of that to be cleaned up. It's common sense that cleaning is important in healthcare, and sometimes cleaning is enough, but sometimes disinfection is necessary. Cleaning doesn't kill germs, it removes them. Disinfection kills germs. Disinfection shouldn't come before cleaning. They either happen at the same time in a single product, or cleaning comes first in the two-step process of cleaning and disinfection. Why is that? When you do disinfect, it's important that the surface is clean, because if it isn't, the disinfection might not work. The product might not be able to get to the germs because they're covered in other things. If there's dirt or spills or smears on the surface, the other thing is that you might spread that around while you're disinfecting, because the disinfectant won't necessarily pick that up and clean. So killing germs is important in healthcare because bacteria that is there that can get into our patients who are ill and weak. And the same goes for viruses and other infectious germs. And when our patients are ill and weak, they're more likely to get really sick from certain germs that we find in healthcare. So you can see why cleaning and disinfection are both so important. We've posted a link to more information in the Facebook comments below, including a list of disinfectants that are effective against SARS-CoV-2, which is the virus that causes COVID-19. So be sure to check us out on Facebook, as well as on Twitter and YouTube, where our videos are getting posted now as well. Of course, if all of those aren't your bucket of tea, we can have you check out our CDC website, cdc.gov/Project Firstline. With that, we'll see you all with the next episode.
Okay. So I want to, first of all, thank you all for having us. Second of all, I apologize for my technical difficulties. And I am going to have to jump off here. I have another call I need to be on, but Liz is going to stay and answer questions. And Kathy, I think we gave you our contact information. Feel free to reach out to us at any time. We can help you answer questions, give you some more resources. Anything you need, we'd be happy to help you. So thank you again.
Cindy, thank you for joining us and for making time. And we'll see you back here, I think, next month.
Okay, thanks.
Okay, so now we will be moving on to the Q&A portion of this webinar. If you have a question for Liz, please drop it in the chat at this time or use the Q&A tool in your Zoom menu. I've already put some information in the chat. I dropped in Elizabeth and Cindy's emails, and I think we've got the link to that video now. And I also put in a link to that CDC site about reducing risks from surfaces core components. That was the website that Cindy was screen sharing. While we're waiting, I'd again like to invite everyone to next week's webinar, which will be about fostering engagement between medical directors and facility staff. That will be next Wednesday at 2 p.m. We also invite you to join our live chats every Tuesday and Thursday at noon. If you have questions about topics such as quality improvement initiatives, infection control, or MDS coding, our quality improvement specialists will be there on that call and can help you do a one-on-one if you want to. You can also find the links to our live chats and webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like that to be on that mailing list but don't think you're on it yet, you can contact me at ccaudil@qualityinsights.org and I will get you on that list. And I will drop my email in the chat and check to see if we have questions. Liz put her phone number in there if anybody would like to give her, if they need to give her a call on her work cell. And I don't see any questions so far, so there might not be any today. If you do have a question, you might want to raise your hand to let us know in case you don't have time to type out your question. All right, so it looks like we're not getting any extra questions for today. So Liz, do you have anything else you'd like to add before we close out for today?
Just that I know this seems pretty basic information, but again, when we're out and we're doing our ICAR visits, the environmental surfaces, the cleaning, the processes, the policies, they continue to be conversation pieces that we see a lot of our observations don't match the policies or the procedures. So, if anything that you take away from this today, go back and review what your policies, your procedures, and what your environmental staff are actually doing. I've always said the infection preventionist is like the body of a spider. And even though you're not the manager over environmental services, you still need to make sure they're doing what they're supposed to be doing, because if they're not, it's going to be an infection prevention and control problem that you're going to have to deal with. And if you guys have anything that you want to talk to us about, we can talk to you on the phone. We can come in and do a consultative ICAR. I know you guys are probably tired of me shoving those down your throats. We're not regulatory again. And, we just want to come out and help you guys. So my phone number's in there. And if you guys have any questions or anything, please call me.
Okay, thank you, Liz. And since we're not getting any questions, I think I can go ahead and wrap us up. I also put in the chat the link to the West Virginia Project Firstline website, which is where a lot of this information came from today. So I will go ahead and I'll go ahead and wrap us up, since that's it for questions. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Liz, thank you for joining us today, and look forward to seeing you back here again soon. And I'd like to thank everybody in our audience for joining us today, and hope to see you back here again next week.
Thank you all. Have a great week.